Okay, so hi everybody, this is Dr. Uzi Chen here, and I wanted, as an instructor for the Points 2 class of acupuncture, to give you a little bit more of a understanding about palpation skills as it relates to the backside. So we're gonna, as we're covering, or as we're gonna cover the urinary bladder channel, this is the longest channel of the body. It has 67 different points. Majority of the points is also along the posterior aspect of the body, what we call the back, neck down to the lumbar region, sacrum region. And before we're going to be talking in specifics, what I think we need to do for you is to walk you through a little bit about how to find yourselves around the back of a person. Most people you're going to be treating, especially for lower back or any situation that has to do with the backside, is going to be in a prone position. That means the person is actually facing down, laying like our patient here. And what we're going to be doing is just to give you some understanding about where we are on the map. If we can get you to understand where is the different body landmarks around it and how to find them and be definite, like know for certain that this is where you are, then it doesn't matter if we cover the do-my channel or the bladder inner channel or the lateral aspect of the bladder channel. You guys will know how to find it accurately. This video is when the person is actually face down. We might do another video when the person is actually upright, sitting, as that will be more pertaining to point location within exams and things like that, okay? So I'm just gonna get started. We're gonna start at the lower back because a lot of the work you guys are gonna be doing in actual life will have a lot to do with the lower back, okay? And then we're gonna move into the neck, and we'll talk a little bit about the mid-back as well. So let me get you started. First of all, when we have the person in that position, for me personally, it's important that we are making him very comfortable. It's important that you do expose the buttocks just enough that we can see sort of like the crease, if you will, the crack between the buttocks, because it tells you where things are. And then as we start to understand what's going on here, we're going to be looking into different locations. The first location I'd like to explain is how to find the lumbar sacral junction. This is where the spinal column actually ends and the sacrum begins, okay? So that's very important. Note that that location, if we did it correct, we'll be able to find the posterior superior iliac spines of the ilium bones, which are right here, and I'll review that in detail in a moment. It is also very important to recognize where the iliac crests are and be able to actually find them when we go in and then down. You want to be able to find those bony landmarks, as well as push up a little bit and find where are the end of the ribs, where's the rib cage actually starts or begins. So on my patient here, it's around here. I can feel that, okay? So if it's a little ticklish there, but we want to be able to know where we are. We also want to be able to understand that there's two lines of muscles that are just parallel to the spine. Those are in general known as the erector spinal muscles, and those are where we're going to be locating a lot of the either the bladder points or the Huato GIG points, okay? To our conversation today, let me just walk you through. I know where we're starting, okay? And then if I'm going to take you just a bit from that angle, most people will have a little bit of a natural curvature of the, you can say the pelvis as it rounds down to meet with the lumbar spine, okay? And then there's a little bit more of what we call lordosis. This is the lumbar lordosis. And then it's going to start to meet with the thoracal aspect of the spine and the thoracolumbar junction around T12 into a kyphotic curve that then goes down towards the neck. And usually here we'll find another lordotic curvature of the cervical spine, the neck spine, okay? Now, when we go and look for that junction, which is super important to know where we are on the body, we want to be able to use a few fingers. I usually do either 2 or 3 because I'm getting much more information about that. So as I'm starting to glide down, I'm going to be also looking to find where the sacrum ends, and I can start to feel the spinous process of the lumbar spine, let's say L5 in this case. To make sure that this is correct, I can also back up a little bit and I feel, oh, this is a flat bone, that's part of the sacrum. But as I'm coming up, oh, right there's a crease and there's a spine between my two fingers. So that tells me it's almost positively 100%, 99.90% that I'm there. Now, to really make sure that I'm there, I know that the posterior superior iliac spine, those prominences that are so easily, you could say, palpated, are going to be in the same line. So I'm going to use 3 fingers and 3 fingers, and I'm going to look for the boundary of that. Where's the prominence? It's right there. So my middle finger right now is right on the top of that sort of like little mountain. It's almost like I'm reaching over that type of a structure, and then I can be falling off of it if I go forward, falling off of it if I go backwards, falling to the side or falling inward. Okay, that's what I'm going to be looking to find. So again, L5, right there is the PSIS on the right there is the PSIS on the left. I know where I am. Super important when it comes to finding different muscles that affect the whole region. Okay, so that's number 1. From here we can actually go up and find, oh, that's L4. L5, L4, very, very commonly used with a lot of conditions that affect the lower spine. Okay, we want to be able to also palpate those iliac crest, those sort of like round shape bones that comprise the waist, and they go and attach all the way towards the PSIS right there. They are symmetric, and we're going to find it on the other side as well. So we want to be aware of that when we approach. In addition, as we go outside, as I showed earlier, and we want to know where is the top of the iliac crest, these guys are right there. I'm literally riding over the edge of them with my fingers. And as I'm starting to make my way up, I'm going to find, and cautious not to make the person very ticklish, I'm going to find the edge of the rib cage. So now there's the soft aspect, the soft tissue, right? And this is where the ribs start. This is the 12th rib. So I can make my way towards the spine again, because this is where we're going to be meeting T12. T12 is the last thoracic vertebrae where the 12th rib is actually attaching to. So this is where we're going to be finding T12. It also makes sense because when we look at it, there's the end of the lordotic curve and the beginning of the kyphotic curve right there. Okay? T12 is important for us because we can find the back of the stomach just in the same level. So urinary bladder, UB or bladder is the same way to refer to that channel. The point of the stomach that I was mentioning is UB21 at the level of T12. Okay, 12 and 21 actually, interesting that they match. In addition to that, let's put a pause for a moment. All right, what I'd like to take you now through is how to find your way on the base of the neck, because most of us heard about like the cervical spine and then the thoracic spine meeting point at like C7 or T1, but how to know for sure where you are. This is important for testing, but also for your actual clinical abilities, right, or skills. So one thing I'd like to show you is when we talk, and I'm gonna make another video where you guys can see it on a whiteboard, but for the most part, just like the thoracic, I would say the 12th rib attaching to the, the 12th thoracic rib or the T12, then we can consider the first rib to be attaching at T1. That means that if you're looking for C7, C7 is going to be on top of T1, and that should give us some clues about how to locate it. So watch me for a second. I'm going to put both my hands here, and I'm going to compress or depress the shoulders back a little bit with compassion, of course. And I want to clear up the possibility of having any ribs that are above my fingers. So the first rib has to be below my finger. That means that if I'm looking for that point here, if I go, that feels to me like the base of C6 or C7, but if I go here, that's probably the end of C7. Here we go, because T1 is going to be one below that, and that means, oh, now we have a room for the first rib. Here, not so much. That's probably too like superior. That means that I'm on C7, and the first indication or the first area I was in is actually C6. So that helps me to get a little bit more clarity. Is it C6, is it C7, or T1? So again, I'm going to take my palms, I'm going to depress the shoulder or the upper trapezius down with the shoulders, go and push a little bit there, and I want to know where is the first rib. So again, this is too high on the neck. That's probably either C6 or C7, but to make sure, if I go one more, oh, that still makes, you see my left hand here, shows me that if there's any rib, it's going to be below those two fingers. That means that that's C7. And then T1, as you can see, is, oh, that's already too low. There's a rib here. Okay? That helps me personally to know for sure the difference between C7 and to T1. I hope it's helpful. And I think we can stop here for now.